We're going to talk about a certain deadlift cue here for a second. So I'm not saying that one cue is good, a verbal cue for somebody is good, another one is bad. Just in general, all that matters is if that individual gets in the position that you want them in, which is proper, and you gave them this cue, then that works for them. Another cue may work for somebody else. So with this particular one, it's pretty frequently said, and coaches and therapists will make this comment, but the big thing is making sure that when they do it or when you give that cue, they don't do it in the incorrect way. So they may be better benefited by a different type of cue. So the cue is, obviously with deadlift, you're using glutes, hamstrings, everything in the back, posterior chain a lot. And you want to feel tightness in that area when you set up. That way you're not just pulling off the ground from like a lax or loose position that you're more likely to get injured in. So a big cue that you'll hear is you have to feel tension or tightness in the hamstrings during your setup before you pull. So with that, I think that's not a bad cue at all, and some people respond really well. Others, really, what I'm looking for to show you is how giving that cue, you can do it incorrectly, and you're putting the athlete in a position you don't want them to be in. So talking about bracing the core and having the spine in neutral, basically when we tighten up, the line from between chest to the belly button, when you tighten that up, almost like somebody's punching you in the stomach, there should be no movement. So you should not move down to tighten up. You shouldn't extend back to tighten up. A lot of times with that, you need to be tightened up whenever you're gonna do a deadlift or any big movement. With that though, the tightness in the hamstrings or tensioning the hamstrings and using that cue before you deadlift. So the hamstrings detach underneath the butt here on the pelvis. If you tilt your pelvis forward, so I'm gonna do some weird hip movements here, so don't judge. So if you tilt your pelvis forward like that, the hamstrings that attach here, you're actually pulling on them and starting to lengthen them. So if I do that, it's pulling from the top side of my pelvis, which is gonna pull on that hamstring. So when you have somebody set up, and they're set up in a deadlift, if their spine, everything is correct, if they arch their back even more, so if they arch, they're gonna feel more tightness in their hamstrings because they're pulling that pelvis. So essentially you just had them go from what may be neutral to now they're in an extended arched back position. And they will feel more tightness in their hamstrings with that, but it's not a good type of tightness that you're looking for. So you're basically just putting the pelvis in a position that then it pulls on the hamstring more, and you're actually getting out of position. So with that, I don't think it's a bad cue, but my goal was just to kind of relay, watch and see if when you say tighten the hamstrings or feel tension in your hamstrings, if they actually just tilt the pelvis a little bit more and get extended in the low back, because that's not what you're looking for. So you may have to go with a different cue if that seems to be the position that they revert to, is that extension, in order to feel the tightness or the tension in the hamstrings.